in.
Hi,
Hi.
I'm Tracy. I'll be your student nurse today.
Hello.
Okay, let me wash my hands quickly.
Okay.
Okay, and I'm just going to verify your name and your date of birth.
Tiffany Henry, 72781.
All right, Miss Henry, today what we're going to do is a head-to-toe physical examination.
Okay.
And I'm going to begin by inspecting your head, scalp, and your face.
Okay.
All right, so I'm going to start with your scalp. Just checking for any lesions, lumps, or infestations. I don't see any, so that's good. Okay, next, Miss Henry, I'm going to palpate your sinuses, so I'll be placing my fingertips on your forehead first. So this is your frontal and your maxillary. Any pain or tenderness?
No.
All right. Now what I'm going to do is I'm going to inspect your eyes. First, could you raise and lower your eyebrows for me? Okay, eyebrows rise and fall symmetrically. Okay, your pupils are round and equal. Okay, so now I'm going to pull down on your lower lid, and when I do so, I want you to look up for me.
Okay.
Just inspecting open your eyes and pull down. Okay, conjunctivitis, pink and moist. Now I'm going to pull up on your eyelid, and I want you to look down for me. Okay. Open your eyes. Look down. Okay, your sclera is white, clear, and moist. All right. I'm just going to assess your pupils for reaction to light. Just look ahead.
Sure.
All right. Now, Miss Henry, I want you to follow my pen for me. Now what I want you to do, Miss Henry, is I want you to focus on my pen, look at the wall behind me, and then focus on my pen again. Okay, can you do that one more time for me? All right. Okay, Miss Henry, I saw no indication of ptosis, which would be a drooping of the eyelid. No indication of nystagmus would be an oscillation of the eye. So your pupils were equal, round, reactive to light, and showed accommodation.
Okay, good.
Okay. Okay, now I'm going to palpate your auricles, which are your ears. And I just want you to let me know if you have any pain or tenderness.
Okay.
Okay. Your tragus. Okay, and I'm just going to check inside your ear canal for any cerumen blockage or drainage or lesions, which I don't see any there. All right, I don't see any there. Okay, that's good. Okay, next I'm going to be inspecting your nose.
Okay.
All right, could you flare your nostrils for me? Okay, your nostrils flare symmetrically. Your nose is nice and smooth. Okay, just tilt your head back slightly. Going to inspect your internal. Okay, mucous membrane's nice and pink. No indication of a deviated septum. It's midline. No lesions or discolorations. Okay. Next, Miss Henry, I'm going to inspect for patency. So just with your mouth closed, I'm going to place one finger on one nair, and I want you to sniff. Okay. Okay. Patency sounds clear. No indication of any airway blockage, so that's good. All right, next, Miss Henry, I'm going to inspect your mouth. Can you just smile for me? Okay, show your teeth. All right. Okay, your lips are nice, pink and moist. I don't see any lesions or discolorations or bumps. I'm going to have you tilt your head back slightly. Open your mouth. Okay, lift your tongue side to side. Now say ah. Okay. All right, Miss Henry, your gums were pink and moist. Your teeth were very white and clear. Mucous membranes, pink, moist. Tongue was pink and moist also. Your soft palate and hard palate, I saw no lesions. Your uvula rose midline, and then the pharynx, I saw no white spots or anything that would indicate a buildup of drainage. and then your tonsils were intact.
Good.
Okay? All right, now Miss Henry, I'm going to inspect your neck. Okay, and can you tilt your head back? I'm just going to inspect your trachea. Trachea is midline. Okay. No visible enlargements of the thyroid gland. All right, it's nice. Could you turn your head slightly to the right? I'm going to assess your carotid. Okay, visible pulsation. Slightly to the left. Visible pulsation. Okay. Next, I'm going to auscultate your carotid artery, and I'm just going to check for carotid bruitary. Okay. And your head slightly to the right, please. Okay, could you hold your breath slightly? Okay, breathe. And your head, please. Hold your breath. Breathe. Okay, I didn't hear any indication of the carotid bruitary, and if I had, then that would indicate that there's a narrowing of the blood vessels, which is indicative of backflow of blood.
Okay.
Okay, next, Miss Henry, what I'm going to do is I'm just going to inspect and palpate your anterior thorax. Just checking for any lesions. Feeling for moisture, no presence of diaphoresis or edema. Okay. Temperature is warm, skin is nice and smooth. Okay, could you just take a breath for me, deep breath for me? Inhale and exhale. Okay, your chest rose and fell symmetrically. No indication that you had to use your accessory muscles, which are located inside your thorax. Okay. Next, I'm going to auscultate your lung fields, and there's 8 spots. Lung field sounded clear, breathing was passive, didn't hear any rhonchi or wheezing or pleural friction. All right? Okay. Next, Miss Henry, what I'm going to do is do you give yourself monthly breast self-examinations?
Occasionally. Sometimes I tend to forget.
Okay. It's okay. Well, it's important to do so monthly, and so I'm just going to show you how to do that. Okay? You want to do this after your menstrual cycle, beginning of each month.
Okay.
And so what that does is it helps in early detection. Okay? So you'll just put one hand behind your head, and you'll start at the nipple, and you'll work in a circular motion outward in a spiral. You'll work all the way up into your maxillary area, your axillary area. Okay? And if you feel any lumps or masses, you would definitely want to contact your healthcare provider. Now, at the end of doing so, you want to squeeze your nipple and note just any discharge you see.
Okay.
And then you'll do the same on the other side.
Sure.
Okay? And you can do this in the shower, less friction of the skin is involved, and comfortably lying down in the bed.
Okay.
Okay? All right, next, Miss Henry, what I'm going to do is I'm going to inspect your anterior thorax cardiac system.
Okay.
Okay? And I'm just going to auscultate. Okay, so at the second intercostal space is your aorta. Okay, second intercostal space on the left side is your pulmonic valve. Okay, between the fourth and fifth intercostal space, just medial of the sternum, is your tricuspid valve. And at your fifth intercostal space is your mitral valve. Okay? Now I'm going to assess your apical pulse. And that's located at the fifth intercostal space, just left of the midclavicular line. Alright. Okay, Miss Henry, upon auscultating your apical pulse, I didn't hear any indications of dysrhythmia or murmurs. Alright. Alright, next, Miss Henry, I'm going to inspect your posterior thorax.
Okay.
Bring your hair forward. Okay, I'm just checking for any diaphoruses, any lesions, edema. I don't see any. Skin feels warm, nice, dry and smooth. Okay, could you inhale for me? Exhale. Okay, your chest wall rose and fell symmetrically. Now I'm going to check your spine. Just make sure it's midline, no indication of scoliosis or kyphosis. Okay. Now I'm going to auscultate your lung fields on your posterior thorax. There's 10 spots. And laterally on the right side, could you raise your arm? Okay, and bring it down. Okay, after auscultating your lung fields on the posterior thorax, I didn't hear any bronchi or wheezing or pleural friction, so that's also good. Now I'm going to inspect your upper extremities. You could just bring your arms forward for me. Just making sure there's no edema, petechia, no diaphoruses. Your skin is nice, warm to the touch, and dry. Okay. I'm going to inspect your nails for any clubbing, which I don't see. And then I'm just going to check your capillary bed refill. Less than 3 seconds. Less than 3 seconds. Okay, now I'm going to assess your range of motion and your strength. So I just want you to mirror me. Okay, flexion, extension, adduction, abduction, and adduction. Okay? Now what I want you to do is place your hands like this, push down, okay, now push up. All right, great. Okay, Miss Henry, now the next part of our assessment, I'm going to be assessing your abdomen, so you're going to have to lie back for me. Do you need any help?
No, thank you.
Okay. All right. So I'm just going to assess your abdomen and check for the contour and symmetry, and it's symmetrical, it's nice and flat. Okay. Dry to the touch. All right, Miss Henry, now I'm going to auscultate your abdomen, and I'm just going to listen to the presence of bowel sounds, okay? And we do so in 4 quadrants, all right? So we'll start with the right lower quadrant, upper right quadrant, move over to the upper left quadrant, down to the lower left quadrant. Okay, bowel sounds were present, and no indication of hyperactivity or hypoactivity of your bowel sounds. If I had not heard any presence of your bowel sounds, I would have auscultated for at least 5 minutes in each quadrant until we heard something, okay? Okay, next, Miss Henry, I'm going to place my hands on your abdomen, or I'm going to palpate and just check for any masses or enlargements, okay? You let me know if you feel any tenderness or pain. Did not feel any enlargements or masses of your abdomen, so that's great. Okay, Miss Henry, I'm going to inspect your lower extremities, your range of motion, and your strength. So just looking for any lesions, edema, no indication of petechia. Okay, so what I'm going to do now, Miss Henry, is I'm going to bring your knee towards you. That's flexion, extension, abduction, and adduction. Okay, now could you lift your leg for me, your right leg? All right, press down. Okay, we have flexion and extension. I'm going to check your capillary bed refills. Less than 3 seconds. Now I'm gonna inspect your, palpate for your brachial or your dorsalis pedis. Okay, and your posterior tibial. Okay, your dorsalis pedis pulse and your posterior tibial both were bilaterally equal. Okay. All right, Miss Henry, now if you want to just turn around and you can just sit up for me. Okay, Miss Henry, what I'm going to do finally is I'm just going to assess your radial pulse and your brachial pulse.
Sure.
Okay, so if you could just bring your arms out for me. Your brachial pulse and your radial pulse. Okay. Your brachial pulse and your radial pulse were equally, bilaterally equal. I just want to do one last thing and assess for skin turgor. Okay, elasticity, no tinting of the skin. All right, Miss Henry, this completes our physical examination. Do you have any questions or concerns for me?
I don't.
All right, well, thank you for your time.
Thank you.
Have a great day.
You too.